Thanks for joining us again, Peter. I wanted to first up get your epidemiology analysis, really, of the Victorian situation. This is the highest level of community transmission we've had from the start of this pandemic, isn't it? Just how concerned are you about it?
Well, I'm quite concerned. This isn't just the highest level, it's the much highest level. Because early on, when we had our peak in late March, it was predominantly people from overseas and cruise ships, at least 80, probably close to 80% with their immediate contacts. Well, this is true community transmission, not related to that. So this is quite a concern because, particularly because we're seeing large numbers of new cases diagnosed per day and it's going up. So this is what you worry about, and particularly what you worry about in winter when it's more likely that these viruses would spread by droplets.
It proves in the negative sense, doesn't it, just how logical and well practiced that quarantine wall was. We surrounded our country with this wall of quarantine for international returnees, and it's worked famously everywhere in the country. But where there was a breach in Melbourne, it's proven very, very difficult indeed.
Yeah, I think it is a concern because, in fact, it was quarantine hotels are high risk. There's probably a few percent of return travellers that come down with COVID. So it's more than 1% of the population in a quarantine hotel. Yet, apparently, breaches occurred with security guards that allowed, in effect, one of these foreign viruses to get out of where it should be contained, to get into the community through their own friends and families and then spread further. So we really do need to make sure that high-risk areas, be it, wherever COVID cases are, that we have adequate training of the people there, adequate supervision, and adequate personal protective equipment, including face shields, masks, or whatever we need, to make sure we minimise the risk that virus will spread from person to person and then spread further in the community.
You mentioned the fact that it's winter. Of course, months ago you were warning us, look out, there will be more transmission in winter. That's the way these things go. Obviously, Melbourne has the winteriest weather of all the major cities in this country. Those conditions must have played a factor?
Well, I presume it may have. I mean, I guess it's the bias from people who aren't in Melbourne, but they always think in winter, at least Melbourne has colder and more miserable weather that makes you stay inside more. And we know being indoors with crowds is much more risky than being outdoors. So the fundamentals of this just make it easier for these viruses to transmit in winter, which is basically people close together, more crowded together with relatively poorer ventilation. And again, it's particularly people who are sick, going to work, mixing with friends. We need to actually basically keep washing our hands, but particularly keep physical distancing, keeping crowd numbers down as low as possible. That's commensurate with how much transmission you've got locally. And particularly people who are sick need to stay at home, keep away from people even at home, but particularly don't go to work, don't go to public transport. And if you know anybody who's sick, don't go near them as much as you can.
Now, we know, of course, the elderly in particular are very vulnerable to this disease. It's deadly with people who are elderly or have a pre-existing condition. What about the percentages now of infections that result in only mild or symptoms or no symptoms at all? Is it still up in the high 90s? Are we still talking about 98, 99%?
Well, the death rate is very dependent on age. If you're over the age of 80, you've got more than a 10% death rate, even in Australia, which has a lower mortality than a lot of other countries. But if you're under the age of 30, your death rate is much less than 0.1%, so a 100-fold difference. And also, the younger you are, the more likely you are to have mild or minimal symptoms and not get sick enough to get to hospital. And that's why Singapore's death rate is so low. Most of their cases are occurring in migrant workers in very crowded hostels with 20 or 30 people in the one room, yet their death rate looks low even though they've got a lot of infections. And that's one of the problems we've got is the people that are transmitting this most are people in their 20s and 30s, but the people who suffer the most are the ones who are older, particularly over the age of 80. But we need everybody to decrease their chance of spreading their droplets to others if we want to keep this under control and contained. And I think what we have to assume is this virus might be everywhere. I think one of the problems we've got is when we don't see it for a while, be it in Western Australia, South Australia, or even Canberra, where I am, you think, oh, we don't have a problem. And you get complacent about the basic rules. And those basic rules, unfortunately, we're going to have to continue for 18 months or 2 years longer, or even possibly even worse than that if we don't get, it's until we get a safe and effective vaccine that is able to be widely used, at least within this country and preferably internationally.
Just briefly then, Peter, when you look at the lockdown measure that's been imposed now, when we see the effectiveness of these measures in months gone by, we would expect, given the numbers of infection at the moment, that Victoria should be able to get on top of this?
Well, the incubation period of this virus, the average incubation period is 5 days. So if you do anything, you might take at least 5 days to see it affect and probably 10 days to 2 weeks. So I guess within, a week from now, we should be seeing less cases per day and hopefully even sooner because of the lockdowns they've had in the higher risk suburbs, even over the last few days.
Thanks again for joining us, Peter.
Thank you.